Om Swastiastu to all our doctor and friends. Greeting to Dr. Mulyarta as our evaluator and Dr. Putu Cinta as our facilitator in this block. Welcome to our presentation of student project. The topic is dry eye syndrome. My name is Gede Bayu Bramantara with my last 3 digit of student ID number is 057. These are our member of B4 student group discussion in this semester. And this is the table of contents of our student project.
Hello, my name is Luh Wina Saraswati with last 3 digits of student ID number 142. Now I'll explain about the background of this student project. Dry eye, also known as dry eye disease, dry eye syndrome, and keratoconjunctivitis conjunctivitis, is defined as a multifactorial disease of the ocular surface that characterized by loss of tear film homeostasis accompanied by ocular symptoms. Dry eye has a significant impact on the quality of life of sufferers due to the chronic eye pain and discomfort and functional visual impairment. Dry eye impacts functional vision in daily life, such as for reading, use of computers, driving, watching television, and others. Not only does dry eye impact daily life, but it also negatively affects the mental health. Dry eye is caused by several factors such as personal, environmental, clinical disease, medication, and ocular factors. There are many factors that cause dry eyes, especially in some people who have work demands to stare at the screen for a long time. Therefore, in this student project, we will discuss about the dry eye, how to deal with it, and how to prevent dry eye. That's all from me. The presentation will be continued by my friend. Thank you.
Hello, my name is Gede Raka Samudra with the last 3 digits of student number 0 to 3. Now I will explain you about the problem formulation. This student project consists of 8 problem formulations, 8 purposes, and 3 benefits. That's all from me. Thank you.
Okay, thank you for your time. Hello, my name is Naomi Margareth Panjaitan, and my last digit of the number is 167. Here I'm going to explain about the definition of dry eye syndrome. Dry eye syndrome is also known as dry eye disease or keratoconjunctivitis. It is a general term that used to describe several conditions or symptoms that occurs when tears are able to provide enough moisture to the eye. That's all from me. The next slide will be presented by me. Thank you.
Hello, my name is Nadya Zalfa with the last 3 digit identification number 079, and I would like to deliver 2.2 about risk factor and epidemiology. So, according to research conducted in 2020 in America indicates a prevalence rate of approximately 14% among adults aged 48 to 91 years. In Indonesia itself, the prevalence is approximately 27.5 based on a sample size of 158 individuals aged 21 and above. Meanwhile, for the risk factor itself, the most common is being female, wearing contact lenses, thyroid abnormalities, hypertension, the use of antidepressant, antihistamine, and prolonged usage of digital display terminals like computer, smartphones, tablet is recognized as a significant risk factor, primarily due to its impact on disturbed blinking patterns. Thank you.
Hello, my name is Bintang Dila Puspapitari with my last 3 digit student ID number is 157. Here I'm going to continue to explain about 2.3 etiology. Dry eye syndrome is a multifactorial disorder. There are several etiologies that may cause dry eye syndrome, such as systemic medications like antihistamines, antihypertensives, meibomian glands malfunction, dermatological diseases that affecting the eyelids, such as rosacea or eczema, ocular procedures like laser, cataract, keratoplasty, and lid surgery. And it also can cause by increased computer or device use, vitamin A deficiency, use of contact lenses, herpes virus infections, systemic health conditions like thyroid disease, and it also can be caused by environmental, like from irritations by chemical fumes, cigarette smoke, pollution, and low humidity. That's all for me. Next will be explained by my friend. Thank you.
Greetings to our evaluator and our facilitator. My name is Felix Zefanya Jhonson Lubis with the last 3 digits of my student ID number 113. Now I'm going to explain about the pathophysiology of dry eye syndrome. Basically, dry eye syndrome can be initiated or amplified by extrinsic factors such as drafty environment, contact lens wear, and also LASIK surgery. And intrinsic factors such as aging, female sex, systemic autoimmunity, and also dysbiosis can cause tear instability and tear composition changes, including hyperosmolarity that activates stress signaling pathways in the ocular surface cells, which triggers production of innate inflammatory mediator, which can lead to recruitment and activation of CD4 T cells, which produce cytokines that cause corneal, conjunctival, and lacrimal gland epithelial disease. That's all from me. Thank you.
My name is Gede Bayu Bramantara with my student ID number is 20025111057. Next is clinical manifestation of dry eye syndrome. Actually, dry eye syndrome has quite very and quite tricky to differentiate it from infection, allergic response, or any other systemic causes. And also, the clinical manifestation listed down below can also be vary from mild to severe. The clinical manifestation are such as irritation, foreign body sensation, occasional epiphora or excessive tearing, which is only occasional, unspecific pain, it can be dull pain or sharp pain, redness of the eyes, blurred vision, and also can sometimes can worsen to decreased vision, every eyelid feeling and twitching, frequent blinking, which is our eye try to produce tear or shed tears, dryness feeling of the eyes, inability to produce tear, and also fatigue eyes.
My name is Mira Amba Grace Fricha with student ID number 2002511018, and I will talk about the diagnosis of dry eye syndrome. So diagnosing dry eye syndrome needs to be done to differentiate it from other cases such as hypersensitivity syndrome, infections, or other systemic disease symptoms, which have different managements as well. So the diagnosis can be done through anamnesis, through Basic 7 and Fundamental 4, accompanied with questionnaires and ophthalmologic examinations. There is no gold standard in diagnosing dry eye syndrome. And according to Asia Dry Eye Society 2017, the diagnosis can simply be stated by clinical manifestation using specific questionnaires and accompanied by tear film instability confirmed by ophthalmologic examination. Some of the questionnaires that can be used are Ocular Surface Disease Index or OSDI, McMoney's questionnaire, Women's Health Study questionnaire, Dry Eye Related QOL score or DEQ, and some of the ophthalmology examinations that can be done are TBUT or tear film breakup time, skimmer's test, cornea conjunctiva staining, examination of the eyelid margin, and also Meibomian gland orifice assessment. A detailed description of the tear film breakup patterns for each type of dry eye syndrome is illustrated in Figure 1, whereas dry eye caused by aqueous deficiency is often characterized by lines or areas of breakup. Dry eye caused by increased evaporation is often characterized by random breakup pattern, and dry eye caused by decreased corneal surface wetting presents as spot or dimple break patterns. On Figure 2, we can see the dry eye classification by ADES, which includes a different target component, breakup pattern, examination, representative disease, etc. for each classification. All of them can be observed in the diagram on the screen. That is all from me. Thank you very much.
Hello everyone, my name is Natasha Pusparani with the last 3-digit number of 227, and here I'll be presenting about the differential diagnosis of dry eye syndrome. Symptoms of dry eye syndrome such as burning sensation, gritty sensation, redness, irritation of the eye may be similar to other conditions, such as first, conjunctivitis. It is a condition where infection or inflammation occurs in the conjunctiva. Conjunctivitis may be bacterial, viral, or allergic. For bacterial conjunctivitis, usually it causes matting of the eyes in the morning and a mucopurulent discharge. For viral conjunctivitis, it would usually have a history of upper respiratory tract infection and watery discharge. Both bacterial and viral are contagious, so it would be necessary to do history taking on the people around the patient if they have similar symptoms. Meanwhile, allergic conjunctivitis is usually seasonal and the patient most likely has a history of allergy or atopy. Second, blepharitis. It is a condition where inflammation occurs in the eyelid margin. In blepharitis, there would usually be visible crust on patients' eyelids and flakes on lashes. It is necessary to do a slit lamp exam to confirm blepharitis. In anterior blepharitis, it would show edema and redness on the margin of the eyelid, whereas in posterior blepharitis, it shows dilation and obstruction of meibomian glands. Third is keratitis. It is the inflammation of corneal layers. Usually, patients would show signs of corneal ulcers and corneal scarring. Keratitis may either be infectious or non-infectious. To confirm keratitis, further exams should be done, such as gram staining and 10% KOH mount. That is all from me. Next will be continued by my friend.
Good morning, doctor. My name is Natasha Pradnya Devi with 3-digit number 056. Now I will explain the treatment of dry eye syndrome. The treatment of dry eye syndromes follow a systemic approach which may be influenced by the severity of the conditions. Initial steps including educating the patient about the ailment, modifying their environment, which involves eliminating sources of high airflow or fans, reducing screen time, and employing a humidifier. And the next treatment, identify and discontinue any causative topical or systemic agents, applying topical ocular lubricants, and practicing lid hygiene, such as utilizing warm compress and lid scrub, as well as incorporating oral essential fatty acids. Additional treatment may involve the utilization of serum eye drops, considering either oral or topical, exploring therapeutic contact lens, evaluating surgical punctal occlusion as potential intervention. And that's all from me. Thank you.
Hello, my name is Komang Setiari Jaya with my last 3-digit number 037. I would like to continue the presentations about prognosis and complications. Dry eye syndromes, are also known as keratoid conjunctivitis (SICA), is a condition where the eyes experience a decrease in tear production or increased evaporation of the tear film. This condition can cause the eyes to become dry and inflamed. Dry eye syndrome is the main factor that can cause computer vision syndrome or CVS. Symptoms of CVS have been the cause of eye surface abnormalities or accommodative spasms and extraocular etiology such as ergonomics. Discomfort and pain due to dry eyes can have a negative impact on daily life, reducing quality of life and affecting mental health. Activities that can be affected by dry eye conditions such as reading and driving interfere with work productivity, which has an impact on work and personal success. This condition has had a socio-economic impact of tens of millions of people, including the cost of medical treatments and doctor visits, as well as the impact on daily social and physical functioning. There are some cases where the time required for treatments and avoidance at work that may worsen dry eye symptoms, thus can reduce productivity at work. There are reports that individuals with dry eye syndromes experience difficulty in daily activities such as driving, reading, doing professional work, watching televisions, and using computers compared to individuals who do not have dry eye syndromes. That is all from me. Thank you. The presentation will be continued by my friend.
Okay, my name is Devi with the last digit number 197. So the conclusion of our student project is dry eye syndrome or keratoid conjunctivitis (SICA) is a disorder of the tear film with multifactorial causes that has the potential to cause damage to the surface of the eye. Dry eye syndrome can be caused by tear deficiency or excessive evaporation, which can damage the interpalpebral ocular surface and cause ocular symptoms. Dry eye syndrome is thought to be caused by three things, namely ocular factors, systemic disease, and iatrogenic causes, such as drugs or surgery. Symptoms that can be experienced including itching and burning in the eyes, irritation, photophobia, red and painful eyes, and even blurred vision. Several supporting examinations can be used to help confirm the diagnosis, including the Schirmer test, tear breakup time test, and ocular surface staining. Management of dry eye syndrome can use artificial tears. If the degree of disease is more severe, cyclosporine, corticosteroids, and antibiotics. For example, tetracyclines can be used. Non-medical therapy can be done with hydrophilic bandage contact lens and the installation of a lacrimal punctum plug. So that's all for our presentation. Thank you for listening.
Here we can see the bibliography used for our paper and presentation. This brings us to the end of our presentation. We apologize for any mistakes. Thank you very much for your time. See you next time. Goodbye.